Good morning, ladies and gentlemen, and welcome to the part 2 of this episode on diabetes mellitus. Oh yes, my senior shows remain Dr. Joe, a medical doctor and a health promoter. In the part 2 of this video, we will be looking at how diabetes mellitus is treated, how to prevent it, and I'll be sharing with you what to eat if you have been diagnosed with diabetes, as well as other tips to prevent further complications. If you haven't watched the part 1 of this series, this episode rather, please kindly go and watch it first before continuing with this part 2 so that you can flow along with us. Before we continue, I just want you to know that the purpose of this video is not to give you medical advice, rather it is to give you information, and with this information, if you are able to understand it, then you can make choices that hopefully will make you to be more healthy and have a happier life. So let's get started. What should my blood glucose level be? Well, ask your doctors what your blood glucose level should be, because they may have a specific target for you. In general, most people try to keep their blood glucose level at these targets, that is before a meal between 80 and 130 mg per dl. About 2 hours after the start of a meal, it should be less than 180 mg per dl. How is diabetes treated? Treatment for diabetes depends on your type of diabetes, how well controlled your blood glucose level is, and your other existing conditions or health conditions actually. So type 1 diabetes, if you have this type, you must take insulin every day. So because your pancreas no longer makes insulin, so you need insulin to survive. So we now have insulin pen that is commonly used now. You just have to inject yourself with it before taking meal. So usually done before each meal and it's for life. Then if you have type 2 diabetes, in this type, your treatment can include medication, in some cases insulin, but most importantly, lifestyle changes such as losing weight, making healthy food choices, and being more physically active. Then if you have pre-diabetes, the goal is to actually keep you from progressing to diabetes. So treatments are actually focused on treatable risk factors such as losing weight by eating a healthy diet rather, like Mediterranean diet, and exercising more, at least 5 days a week for 30 minutes. Many of the strategies actually used to prevent diabetes are the same as those recommended to treat diabetes. Then for gestational diabetes, if you have this type and your glucose level is not too high, your initial treatment might be modifying your diet and getting regular exercise. If the target goal is still not met or your glucose level is still very high, your doctors may actually start you on medication as well as insulin in some cases. Prevention. So this question people used to ask, can pre-diabetes, type 2 diabetes, and gestational diabetes be prevented? Although diabetes risk factors like family history and race cannot be changed, there are other risk factors that you do have some control over actually. So adopting some of the healthy lifestyle habits listed below can improve these modification risk factors and help to decrease your chances of getting diabetes. Eat a healthy diet such as the Mediterranean or DASH diet. Keep a food diary, a calorie count of everything you eat, actually cutting 250 calories per day can help you lose half pound per week. Get physically active, aim for 30 minutes a day, at least 5 days a week. Start slow and work up to this amount, or break up this minutes into more double 10-minute segment actually. Walking is great exercise, work to achieve a healthy weight. Don't lose weight if you are pregnant, but check with your obstetrician, that's your doctor, about healthy weight gain during your pregnancy. Okay. Lower your stress level, learn relaxation technique, deep breathing exercises, and other helpful strategies that can actually help you to lower your stress level. Then limit alcohol intake. Some studies say that men should not drink more than 2 alcoholic beverages a day. Women should not drink more than 1 actually. Then get an adequate amount of sleep, typically 7 to 9 hours. It's important. Quit smoking, like I said earlier. Then take your medication to manage existing risk factors for heart disease such as high blood pressure, high cholesterol, and also to reduce the risk of developing type 2 diabetes. Now the question some people also ask, can type 1 diabetes be prevented? The answer is unfortunately no, because type 1 diabetes is an autoimmune disease, meaning your body attacks itself. So scientists are not yet sure why some people's body will be attacking themselves, but anyway, other factors may also be involved, such as genetic changes. So what should I expect if I have been diagnosed with diabetes? If you have diabetes, the most important thing you can do is keep your blood glucose level within the target range recommended by your doctor. In general, these targets are usually for before meal between 80 and 130 mg per dl. About 2 hours after the start of a meal, it should be less than 180 mg per dl. And if you have been diagnosed with diabetes, especially type 2, you will need to closely follow a treatment plan, which will likely include following a customized diet plan, exercising 30 minutes 5 times a week, quitting smoking, limiting alcohol, and getting 7 to 9 hours of sleep at night. Always take your medication and insulin as instructed by your provider. Now, does eating sugary foods cause diabetes? Well, sugar itself does not directly cause diabetes. Eating foods high in sugar content can lead to weight gain, which is a risk factor for developing diabetes. So eating more sugar than recommended, the American Heart Association recommends not more than 6 teaspoons a day, that's 25 grams for women, and 9 teaspoons, that's 36 grams for men. Because if it's more than that, it leads to all kinds of health harms in addition to weight gain. So these health harms are all risk factors for the development of diabetes. Can actually worsen the complications. So weight gain can raise blood pressure, cholesterol, and triglyceride level. It can also increase your risk of cardiovascular disease. Can cause fat buildup in your liver, and also can also cause tooth decay. So how does diabetes lead to amputation? Well, uncontrolled diabetes can lead to poor blood flow, poor circulation. Without oxygen and nutrients delivered in the blood, you are more prone to the development of cuts and sores that can lead to infection that cannot fully heal. So areas of your body that are farthest away from your heart are more likely to experience the effect of poor blood flow. So areas of your body like your toes, your feet, your legs and fingers are more likely to be amputated if infection develops and healing is very poor. Now, how and what should you eat when you have diabetes? We have the diabetes PET method, which is the easiest way to create healthy meals that can actually help manage blood sugar. So using this method, you can create perfectly portioned meals with healthy balance of vegetables, proteins, and carbohydrates without any counting, calculating, or weighing or measuring. So all you need is actually a plate. Assuming you have your plate in front of you, imagine 2 lines drawn on your plate, breaking it into 3 different sections. So fill the first half of your plate with non-starchy vegetables. Non-starchy vegetables are lower in carbohydrates, so they do not raise blood sugar very much. They are also high in vitamins, minerals, and fibers, making them an important part of a healthy diet. So filling half your plate with non-starchy vegetables means you will get plenty of servings of these superfoods. Examples of non-starchy vegetables are, you have broccoli, we have cabbage, the green ones, the red one, we have carrots, we have celery, we have cucumber, we have eggplant, we have leafy greens, we have green beans, we have salad, we have tomatoes. Then the other half you divide into 2. Fill 1/4 of your plate with lean protein foods. Food high in protein such as fish, chicken, lean beef, soy product, and cheese are all considered protein food. So protein food, especially those from animal sources, especially contain saturated fat, which may increase your risk of heart disease. So lean protein are lower in fats and saturated fat, making them a healthier choice. So keep in mind that some plant-based protein foods like beans and legumes are also high in carbohydrates. So examples of lean protein foods include chicken, turkey, and eggs. Fish like tilapia, salmon, plant-based sources of protein, we have beans, lentils, nuts and nut butters. We have tofu also, and plant-based meat substitutes are also important. Then the last quarter, the last 1/4 of your plate with carbohydrate food. Food that are higher in carbohydrate includes grains, starchy vegetables, beans, and legumes, fruits, yogurts, and milk. These foods, they have the greatest effect on blood sugar level. Limiting your portion of carbohydrate food to just 1/4 of your plate can help keep blood sugar from rising too high after meals. Examples of carbohydrate food, we have whole grain such as brown rice, we have plantain, we have potato, we have sweet potato, we have yam, we have beans and legumes also as well. Also dairy products like milk, yogurt, and milk substitutes, that is soy milk. Then diabetes food care guidelines. So diabetes food care is essential as diabetes can be dangerous to your feet. Even a small cut can actually produce serious consequences. So diabetes may cause nerve damage that takes away the feeling in your feet. So diabetes may also reduce blood flow to the feet, making it harder to heal an injury or resist infection. So because of this problem, you may not actually notice a foreign object in your shoe. As a result, you could develop a blister or a sore, and this could lead to infection or a non-healing wound that could put you at risk for an amputation. So to avoid serious foot problem that could actually result in losing a toe, foot, or leg, it's important to follow these guidelines. So 1. Inspect your feet daily. Check for cuts, blisters, redness, swelling, or nails problem. Use a magnifying hand mirror to look at the bottom of your feet. Call your doctor if you notice anything. Bath your feet in lukewarm, never hot water. Keep your feet clean by washing them daily. Use only lukewarm water, the temperature you use on a newborn baby. Be gentle when bathing your feet. Wash them using a soft washcloth or sponge. Dry by blotting or patting and carefully dry between the toes. Moisturize your feet but not between your toes. Use a moisturizer daily to keep dry skin from itching or cracking. Then, but don't moisturize between the toes. That will encourage fungal infection. Then cut your nails carefully. Cut them straight across and file the edges. Don't actually cut nails too short, as this will lead to ingrown toenails. If you have concern about your nails, also consult your doctor. Then never treat your calluses yourself. Preferably, it's even advised not to even cut your nails yourself, but ask someone to do it for you. Wear clean, dry socks. Change them daily. Consider socks made specifically for patients living with diabetes, because these socks have extra cushioning. They do not have elastic tops higher than the ankle, and they are made from fibers that actually take away moisture from the skin. Wear socks to bed also. If your feet get cold at night, wear socks. Never use a heating pad or a hot water bottle. Shake out your shoe and feel the inside before wearing them. Remember, your feet may not be able to feel any foreign object, so always inspect your shoes before putting them on. Keep your feet warm and dry. Don't let your feet get wet in snow or rain. Wear warm socks and shoes always. Consider using antiperspirant on the soles of your feet. This is helpful if you have excessive sweating of the feet. Actually, never walk barefoot. Okay, not even at home. Always wear shoe or slipper. You could step on something and get a scratch or cut. You might not know. Take care of your diabetes. Keep your blood sugar level under control. Do not smoke, because smoking restricts blood flow in your feet. Hope you have learned something today about diabetes, how to manage it, and prevent its complication as well. Always remember, your health, your choice. Until we meet again, take good care of yourself, and don't forget to make good choices to stay healthy.